This lecture covers disorders of the adrenal glands. The adrenal gland right here is a pyramid-shaped organ that sits on top of the kidneys. There are two distinct regions, the adrenal cortex, which is the outer portion, and the medulla, which is the inner portion. Each produces hormones that affect the whole body. The adrenal cortex maintains homeostasis in response to stressors and is essential to life. This secretes glucocorticoid and mineralocorticoids. The adrenal medulla produces epinephrine to increase blood glucose levels and to stimulate the release of ACTH from the pituitary and norepinephrine. Not as essential to life as the other. The medulla hormones have an effect on cardiac contractions, constriction of blood vessels in the skin, mucous membranes, and the kidneys. It dilates blood vessels of the skeletal muscles, coronary arteries, and pulmonary arteries. Cushing's syndrome is a chronic disorder caused by excessive amounts of circulating cortisol, or ACTH. This is a hyperfunction of the adrenal cortex. It's more common in women, with average age of onset is 30 to 50 years. Individuals who take corticosteroids for long periods of time for the treatment of arthritis or organ transplants or even adjunct chemotherapy are at increased risk for developing this disorder. Some of the manifestations of Cushing's syndrome are going to be related to increased glucogenesis. These patients are going to experience polydipsia, polyuria, and possibly diabetes. Increased protein catabolism can cause muscle weakness, early bruising in the skin, and osteoporotic bones. This also leads to poor wound healing. These patients with Cushing's disease can have reduced inflammatory response and an increase in redistribution of fat. And you can see in this picture right here, we have central obesity. This is what they call a moon face. And we'll have another picture later that will show you a buffalo hump. Some of the characteristics that are used to describe these patients will refer to their body type as a lemon on a stick. They're going to have increased stomach acid production, and the mineralocorticoid effects are going to be sodium retention and redistribution of fluids. Females with Cushing's syndrome may suffer from hirsutism, which is excessive facial hair, and changes in calcium levels, which can lead to osteoporosis, fractures, kidney stones, as well as hypokalemia and hypertension. Some diagnostics to confirm Cushing's: a cortisol level would be elevated. They would also be taking a 24-hour urine-free cortisol level, which would be elevated. ACTH suppression, and that's a 48-hour dexamethasone test, and that will fail to suppress cortisol levels. Their circadian rhythm will also be abnormally high in the evening due to that cortisol levels, and they're going to be taking a CT or an MRI to assess for any tumor involvement. Treatment for Cushing's syndrome can be done with medications. Mitotane would be used to treat metastatic cancer of the adrenal gland. Aminoglutamide inhibits cortisol synthesis, and the octreotide, the somatostatin, that suppresses ACTH secretion. They could also perform an adrenectomy, and that is performed if the cause is due to an adrenal cortex tumor. When this occurs, it's generally only one adrenal cortex that's involved. If an ectopic tumor is involved, the bilateral adrenal glands will be removed. Lifelong hormone replacement is necessary if both adrenal glands are removed. They would also be performing a dietary consult. Diets high in vitamins and proteins are necessary for tissue repair and healing, as well as increased levels in potassium-rich foods. Correct any electrolytes prior to any surgeries, and they may need to remove the pituitary gland if the Cushing's syndrome is caused of a pituitary disorder through a potential craniotomy. The nursing diagnosis for Cushing's syndrome would be fluid volume excess. These patients need to weigh themselves every day, take strict care of their INL, monitor blood pressure, heart rate, lung sounds, and fluid restriction. Increased risk for injury is due to muscle weakness, fatigue, and they have an increased risk for fracture. You want to make sure you remove clutter, provide adequate lighting, assistive devices, corrective lenses, and non-skid footwear. For infection, an increase in cortisol limits and impairs the immune response. Monitor their vitals and assess for signs and symptoms of infection. Educate regarding wound management. And disturbed body image, you want to allow these individuals to have time to express their feelings and discuss strengths and coping strategies. On to Addison's disease. We see here a couple famous people with Addison's. We have JFK and Jane Austen over here. Addison's disease is an autoimmune disorder that involves destruction of the adrenal glands as a primary cause. Other causes can be tuberculosis, TB in developing countries, sepsis, metastatic cancer, hemorrhage, or heparin-induced thrombocytopenia. The infection in turn destroys the adrenal tissue. Hemorrhage or infarction, patients who are taking anticoagulants or have a major trauma or infection. Abrupt withdrawal from steroids can cause secondary adrenocorticoid insufficiency. And then HIV, those pathogens will also destroy adrenal tissue. So manifestations with Addison's disease can develop slowly. They usually only see the signs when about 90% of the function of the gland is lost. The primary manifestation is going to be due to the result of elevated ACTH levels and decreased aldosterone and cortisol levels. Hypoglycemia is evident because of an inability to convert glycogen to glucose, and hyperpigmentation due to an increase in ACTH levels. That is very common and exists in about 90% of the patients. Water and sodium loss due to the kidneys being unable to convert sodium, causing decreased extracellular volume, postural hypotension, syncope, hypovolemic shock, confusion. Hyperkalemia because the potassium levels are retained. Diagnostics for Addison disease, they're going to draw some labs looking for a decreased cortisol level. ACTH is going to be increased if the cause is due to the adrenal gland, and decreased if it's due to long-term therapy with steroids. ACTH is not adequately being produced by the pituitary gland. Glucose levels are going to be decreased as well as sodium. Potassium levels will be increased as well as BUN and creatinine due to the adrenal insufficiency. ACTH stimulation test is going to be the most specific diagnostic level, showing cortisol levels that will rise due to pituitary deficiency, but they do not rise if it's due to an adrenal insufficiency. Primary treatment of Addison's disease is the replacement of corticosteroids and mineralocorticoids, accompanied by an increase in sodium in the diet. Hydrocortisone is going to replace cortisol levels, and some medications will interact with these, including anti-diabetic agents, oral contraceptives, anticoagulants, and NSAIDs. Long-term use can lead to Cushing's syndrome. In the acute phase, these patients will be treated with IM hydrocortisone or IV hydrocortisone in an emergency, fluid replacement, dextrose IV for severe hypoglycemia, and fluticasone is needed for later stages to provide mineralocorticoid replacement. In the long term, they're going to be replacing these as well as monitoring symptoms and cortisol levels, electrolytes, and vital signs. Patients will need to be provided with a steroid identification card as well as wear a medical alert bracelet. Nursing diagnosis, fluid volume deficit is going to be a strict INO, daily weight, monitoring of vitals, encouraging fluid intake to the level of 3,000 mils per day, and increasing your salt intake. Risk for ineffective therapeutic regimen includes lifelong lifestyle changes, and these can be very difficult for these patients to maintain.